This oral suspension is a combination of omeprazole and sodium bicarbonate. It's used to treat stomach and esophagus issues like acid reflux and ulcers, and to prevent stomach bleeding in very ill patients. Omeprazole reduces the amount of acid your stomach produces, and sodium bicarbonate is an antacid that helps omeprazole work better. This medication can relieve symptoms such as heartburn, difficulty swallowing, and cough, and it can also help heal acid damage to the stomach and esophagus, prevent ulcers, and may even help prevent cancer of the esophagus. If you're using this medication without a prescription, make sure to carefully read the package instructions to ensure it's the right product for you. It's important to note that over-the-counter products may take 1 to 4 days to have a full effect, and using the wrong product could harm you. Before taking Konvomep 2 Mg-84 mg/ml oral suspension, make sure to read the provided medication guide and ask your doctor or pharmacist if you have any questions. Take this medication by mouth on an empty stomach, usually once daily, at least 1 hour before a meal. The dosage and length of treatment depend on your medical condition and response to treatment. In children, the dosage is based on weight. Do not increase your dose or take this drug more often than directed. If you are taking the capsule, swallow it whole with a full glass of water. Do not open the capsule or sprinkle the contents into food. If you are using the powder packet, empty the contents into a small cup with water, stir well, and drink the entire mixture right away. If using the suspension, shake the bottle well before each dose and carefully measure the dose using a special measuring device. If you are giving the powder or suspension through a tube into the stomach, ask your healthcare professional for detailed instructions. Do not substitute the capsules, powder packets, or suspension for each other without doctor approval. Take this medication regularly at the same time each day and continue to take it for the prescribed length of treatment, even if you are feeling better. If you are self-treating, do not take it for more than 14 days unless directed by your doctor. Tell your doctor if your condition lasts or gets worse. If you think you may have a serious medical problem, get medical help right away. If you experience headache or abdominal pain while using Konvomep 2 Mg-84 mg/ml oral suspension, make sure to consult your doctor or pharmacist. They can help determine if these symptoms are normal or if they need to be addressed. It's important to note that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects, but it's crucial to be aware of them. Be sure to inform your doctor if you experience any of the following serious side effects: swelling of the hands/feet, symptoms of low magnesium blood level, sudden weight gain, signs of lupus, dizziness, muscle aches/spasms, mental/mood changes, vomiting, weakness, or persistent diarrhea and abdominal pain/cramping. If you do experience diarrhea, it's important not to use anti-diarrhea or opioid products, as they may worsen symptoms. It's also important to be vigilant for symptoms of vitamin B12 deficiency, such as unusual weakness, sore tongue, or numbness/tingling of the hands/feet, as long-term use of this medication may increase the risk. In the rare event of a severe allergic reaction, seek immediate medical help and look out for symptoms such as fever, rash, swelling, severe dizziness, trouble breathing, or signs of kidney problems. As always, if you notice any side effects not listed here, be sure to consult your doctor or pharmacist for further guidance. Before taking Konvomep 2 Mg-84 mg/ml oral suspension, it's important to tell your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any kidney problems, liver disease, or low levels of calcium or potassium. Also, be sure to mention if you are on a low-salt diet or have any conditions that could be worsened by an increase in salt intake. If you experience symptoms such as heartburn with lightheadedness, chest pain, or unexplained weight loss, it's important to seek medical help right away. Additionally, if you have trouble swallowing food, vomit that looks like coffee grounds, or frequent chest pain, it's important to get medical help immediately. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using. For those with diabetes or other conditions that require a limited sugar intake, caution is advised due to the sugar content in the suspension form of this medication. It's important to note that the use of omeprazole, especially in older adults and children, may increase the risk of certain side effects such as bone fractures and infections. If you are pregnant or breastfeeding, be sure to discuss the risks and benefits of using this medication with your doctor. It's important to know that Konvomep 2 mg, 84 mg/ml oral suspension peptic ulcer agents may interact with other medications, which can affect how well they work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include clopidogrel, mavacamten, memantine, methotrexate, especially high-dose treatment, rifampin, St. John's wort. Additionally, some products need stomach acid to be absorbed properly. Since omeprazole/sodium bicarbonate decreases stomach acid, it may change how well these products work. Some affected products include atazanavir, erlotinib, levoketoconazole, nelfinavir, pazopanib, rilpivirine, sparsentan, certain azole antifungals, itraconazole, ketoconazole, posaconazole, among others. It's also important to note that omeprazole is very similar to esomeprazole, so do not use any medications containing esomeprazole while using omeprazole. Finally, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Remember to talk to your healthcare provider about any concerns or questions you may have. If you suspect that someone has taken too much Konvomep 2 mg, 84 mg/ml oral suspension and they are experiencing serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include confusion, unusual sweating, blurred vision, unusually fast heartbeat, and seizures. It is crucial to act quickly in the case of a suspected overdose. If your doctor has prescribed Konvomep 2 mg, 84 mg/ml oral suspension for you, it's important not to share it with others. If your doctor tells you to use this medication regularly for a long time, you may need to have some lab or medical tests done, such as a magnesium blood test or checking your vitamin B12 levels. It's important to keep all of your medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose of Konvomep 2 mg, 84 mg/ml oral suspension, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing Konvomep 2 mg, 84 mg/ml oral suspension peptic ulcer agents, it's important to keep the capsules and powder packets at room temperature, away from light and moisture. Remember not to open the packets until you're ready to use them, and avoid storing them in the bathroom. As for the suspension, it should be kept in the refrigerator, away from light, but don't freeze it. Make sure to discard any unused suspension after 30 days, and always keep all medications out of reach of children and pets. When it comes to disposing of this medication, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.